Hi, everyone. Good afternoon. I'm Dr. Miriam Smith, the host for Empowering New Nurses. I'm a nurse educator, advocate for patients to receive high quality care. I'm author of the book, Nurse, the guide to empowering all nurses in delivery of high quality care to all patients. Every patient deserves the best. I know at times that there are many nurses who feel overwhelmed at times, definitely, because of the workload, because of the shortages, the patient nurse ratio, especially recently, it needs some improvement. So, because of the magnitude of everything, I've thought of having a little devotional for uh, our interprofessional team or our healthcare providers because of such reasons. They are not enough staffing, work environment. Many times, some of the young nurses would say they don't get the support. And I've spoken to nurses who have shared their experiences. And had it not been for some good nurses, some excellent nurses who have decided to take on a new nurse and mentor and encourage, that nurse would have left the profession. And so the seasoned nurses, many of them, I'm not going to say all because that wouldn't be fair, many of them are willing to share their experiences with the younger nurses. Of course, our educators would have curriculum that they would have also followed for onboarding and also for orientation. And of course, our preceptors, we appreciate you. And with all of that, because we know that nurses become fatigued, yes, they become overwhelmed. And sometimes they feel like, did I make the right choice in choosing the right profession? Yes, there are some of those questions that might come your way. But we know that nursing is not just a job, nursing is also a calling. And that's daughter. The first one, she would say, not nursing. Give me some math problem. Give me some engineering situation that I can handle, not nursing. So, and we'll hear from male as well as female. I spoke to a male recently, and he actually said he retired, but he was bullied. And he shared his experience. And I've spoken to different individuals, and they have said the same thing. I remember attending a conference in Texas, Dallas, Texas, and I met young people. And I recall one of them saying, my sister left nursing because it's not nice. She wasn't treated well. Well, I'm not going to say that individuals might not have experiences that are challenging, but I wouldn't encourage you just to leave because of one experience or two experiences. But say, I know I belong here, and you're going to crave and you're going to have relationship with individuals who mean you well. And I always encourage my young nurses to have a mentor. That mentor doesn't have to be from the institution where you're working. It could be from somewhere else. But have somebody you can relate to, and certain experiences that you might need some help with. I mean, some challenges, some procedures, or some skills, or even communication. How do you go about it? Because some of the fears are real. not having such experience and have to give a report or call a doctor, we definitely need, we definitely need to be strategic and share. And I also encourage my nurse not to run away from the experiences. Be prepared mentally. And you have to play, my young nurses, you do have to play your part. Be visible. Certain situations are going, or certain procedures, you haven't had that experience. You might have read it in a book, but that's not the practical. So whenever, buy up some experiences, throw yourself into situation, ask the person who's in charge for some cases, not try to get easy cases. No, you're going to be learning. And when someone else has a challenging or a difficult case, work your way in, ask questions, so that when your time comes, you'll be able to function. It's all about, there are two ways, your way and the other person's way. And you shouldn't be too sensitive either, because in emergencies, there are times when you just A, B, C, D, right? And you have to be aware of that. So after, say, a situation or procedure or code or whatever, after debriefing or whatever, and you have a question, of course, be polite enough to say, I wasn't sure of this. Is that, ask questions. There's no question that is foolish. So that little backdrop is just to say that there are times you're going to feel overwhelmed. You have the interprofessional team. Definitely interact, because each discipline has its way of ensuring that that patient that receives patient-centered care. And as you collaborate, as you put your thoughts and your ideas together to make that plan of care for that patient, things will work differently as opposed to just one-sided. Value each discipline. Value each person who's administering care for that patient, and listen. Listen to that patient. Why did I say that? Okay, so most times the nurse is the one who gets most of the information. The nurse is usually there. The doctor might come, make his assessment, make his recommendation, do his orders, and he's gone. The social worker might be involved in certain aspect of the care, yes. But the nurse is the one who is there 24/7, going in and out, in and out. So just take that extra time out and listen to your patient. Take a little, be intentional about that. Because the day might be so busy, the patient might be calling and everybody, but be intentional. Tell yourself that that patient needs a little of your time. Granted, I know it's busy, but you have to be conscientious. You have to be aware that that patient has something to say, sometimes just to you, depending on how they feel about you. They're not going to say to every nurse, but that relationship, that trusting relationship that developed over that time, you'll have some patients say something to you that they wouldn't have said to someone else. And so, doctor of nursing practice. Yes, that's what I am. That's who I am. Doctor of Nursing Practice, Healthcare System Leadership. Thanks for asking. All right. So, as we interact with individuals, as we interact with our patients, it's important also to remember culturally congruent care. That means that individualized care is important. We're not going to use one type and it's going to fit everybody. No. When you know someone's culture, when you investigate, when you ask, when you research, you're able to give that individualized care, and that will allow the patient to be receive satisfactory care, and you yourself, the nurse, will be satisfied. that you have given that type of care to that patient. I'm from the West Indies, another is from Asia, another is from Europe, another is from wherever. Take a little time out and research, and you'll be surprised. You'll be surprised to see the relationship, the trusting relationship, and the satisfaction that the patient receives after telling you and talking with you, dialoguing with you. It does make a difference. So, I just want to say to you that not everyone might accept this, but it's there for you if you wish to. Because I felt impressed to have done that. So I went through the entire week of a series of seven captions. And the one for today that I chose for the devotional, because you're overwhelmed sometimes, is choosing the part, the better part. And that's found in Luke 10, verse 42. It says, Mary has chosen the better part. The devotional thought is, at the end of a long week, Jesus reminds us that sitting at his feet is never wasted time. The better part is choosing presence over pressure, relationship over routine. As you move forward, choose daily moments with Jesus. Small, intentional, and life-giving. What will you choose? What will choosing the better part look like for you this week? There's a little prayer that says, Lord, help me choose you daily. Let my time with you shape how I live, work, and care for others. So, by yourself, you might just feel like rushing. But if you take that time out intentionally, a few minutes before you go to work or during work time, in your mind, in your break time, you will notice that your tolerance can be improved. You can face certain situations differently than if you had not taken time out. The natural person is to respond, a certain way. You're human. But if you have taken time out to spend and saying to yourself, I need help. First thing, acknowledge I need help because this is more than I can handle. And you ask the Lord to help you, He will. And of course, someone said, should have the right attitude. We have to encourage we can't teach that. We can encourage that. But people come from all different backgrounds, different culture, different homes. But we have to bear in mind that when we come to work and we are interacting with individuals, we should have respect and dignity for those who are vulnerable, most vulnerable. And sometimes be prepared. They're going to just let it out on you. They're going to just let it out. Unfortunately, you might be the one. But then think about it. Some of them are in strange, very strange environment. Their privacies are being invaded. To you, it might seem just another thing, but for them, no. So we should be aware of that all the time as we care for others and do so with respect. Well, I'm not sure about your weather, but it's outside ice and snow and all of that. So you just be careful as you move and be blessed. Have a great week. And remember, I'm looking forward to seeing you again. And I would like you to subscribe to my channel. My channel is Miriam Amanda Smith. That's my channel. All right. And on YouTube, that's on YouTube. On Instagram, it's Podcast Mayor. And of course, My website is Empowering New Nurses. I would like you to subscribe. My little devotional will be coming out this quarter. It's actually in the with the formatter right now. It's just about 5 themes, and it's just helping you to cope, because you know that health is not just mere the absence of disease, but it has to do with the physical, the mental, the spiritual, the entire being, holistic. So that part is important too. So be great and leave a thumbs up and subscribe and share with others. We need each other. Okay, united we stand and divided we fall. We can't. We must embrace each other and each other's culture, each other's contribution to healthcare and to society. Be blessed. Bye bye.